Hello everyone, welcome back to my channel Medico's Guide. It's Dr. Ida Khan, and today we'll be continuing a previous lecture, and this is going to be the part 2 of orthotics. Now we'll be discussing about the shoe, which is basically a foundation for most lower extremity orthoses. It is, you can say, a basic unit for most of the orthoses that we use for the lower limb. Now let's first talk about the functions of the shoe. So shoe transfers the body weight to the ground. It protects the wearer from the terrain as well as from the weather. It distributes the weight bearing forces to provide the optimum comfort, the function as well as the appearance of the foot. Now it also serves two additional purposes for those individuals who are having any orthopedic disorders, and these functions are that it decreases the pressure on the sensitive deformed structures by redistributing the force towards the pain-free areas. So when it redistributes the pressure towards the pain-free areas, this way it decreases the pain and the pressure. Secondly, it serves as a foundation for the AFOs and more extensive bracings. Now let's talk about the major parts of the shoe, and these parts are upper, sole, heel and reinforcement. Okay, now first let's discuss about the upper, that is the first portion of the shoe. So this is the diagram. Here you can see this is the upper of the shoe. Now the upper is basically the portion of the shoe that is over the dorsum of the foot. So as you can see that this part covers the dorsum of the foot, so this is the upper of the shoe. And this upper is divided into two, that is the vamp and the quarter. The vamp is the anterior compartment. So here you can see this is the vamp, while the quarter is the posterior component. So this is basically the area where the foot enters the shoe. So vamp and the quarter are the two parts of the upper. When the insert is used as a foundation within the shoe, then it must be covered with the vamp. Why? So that it can secure the shoe as well as the orthosis onto the foot. And so here you can see that in the vamp area we can find the laces or the strap closure. Now the laces are used for more precise adjustment, while the strap closure for those individuals who have the limited manual dexterity. By this we mean that when the individuals have the weak hand muscles so that they cannot tie up the laces, so in those individuals we use the strap closure. Now there are two types of lace stays. One is the blucher and the other one is the ball or the ball model. Let's first talk about the blucher lace stays. The blucher lace stays are used for most orthotic purposes, and the reason will be discussed ahead. Now what is the purpose, what is the basic difference between both of these shoes? So the basic difference is that in the blucher lace stays there is separation between the anterior margin of the lace stays and the vamp. So here you can see that these lace stays are separated anteriorly, while in the balmoral or in the ball lace stays this is opposite. These are continuous with the vamp, and for this reason we call the blucher lace stays that these are the open lace, while the balmoral as a closed lace. And now let's talk about what was the reason behind for it being used for the most orthotic purposes. So the reason is that it permits the greater adjustability, especially in the cases when the patients have enormous, or you can say the significant edema. So in that case it allows for the greater adjustability, as it offers the greater inlet, the larger inlet into the shoe, because when you would, as soon as you would open up the laces, it would allow the more space for the foot to be entered easily, and henceforth this is preferred for the orthotic use owing to the ease in the donning and adjustability. And as we have already discussed that this is the open lace, while the balmoral is known as a closed lace. And you can easily remember it by this, that in the blucher there is no A, and so you can remember it with the alphabet A, while in the case of balmoral there is the presence of the A, but there is no U or there is no V that similarly resembles the U. So here you can remember this, that there is the presence of the V-shaped lace stays. Alright. Now let's talk about the extra depth shoe. So in the extra depth shoes, as the name suggests, that there is going to be an extra space within the shoe that would be accommodated with the second, or you can say the extra inner sole. Now this extra inner sole is inserted so that it can be easily removed in the cases where the patients are having the hammer toe. And now what is a hammer toe? Hammer toe is basically a contracted toe. There is the deformity of the muscles and the ligaments in the proximal interphalangeal joint of the second, third, fourth and fifth toes, obviously in the foot. So what it basically contributes to, it makes them appear in the shape of the hammer, and that's why it is named as a hammer toe. Okay, now let's understand it with the help of our notes. Extra depth shoe. It is the one that is having an upper contour with additional vertical space, and it has the second inner sole, that is our extra inner sole, that can be worn or it can be removed in the cases of the custom inserts. Whenever we have to insert some inserts into the shoe, so in that cases as well it can be removed, or in the cases of thick surgical dressings, so this is also an advantage of it. And in our last point, it says what we already discussed, that it provides more space in the shoe, as we have discussed that the second inner sole can be easily removed, and therefore it increases the extra space, the space of the shoe, thereby it decreases the stress on foot. Now the next part of shoe is quarter. Now we'll take a look at the diagram so that we can better understand it. So here you can see that this is the diagram of the shoe. This is illustrating the different parts of the shoe, and here I'm just gonna name them because we'll be discussing them in a greater detail ahead. So here you can see this is the sole of the shoe, this is the heel, this is the counter part, this is the quarter, and we'll discuss ahead that the quarter is again divided into the lower quarter and the higher quarter. So this is one of them. This is the upper. This all area is the upper, which we talked about, that this is divided into two parts, that is the vamp area and we have a quarter area. Now this is the toe boxing, this is the toe spring, and here you can see this is the heel part, this is the low quarter, upper, toe spring, and these are the sole breaks, sole break lines. This is sole and this is the shank area. So we call this as a shank reinforcement. Now let's talk about the quarter. So quarter is the posterior part of the upper. Here you can see this is the whole upper, and this posterior part of the upper is quarter. Now this quarter is again divided into two. This is the lower quarter and the higher quarter. Now the lower quarter, as the name indicates, that it would be lower, which means that it would terminate below the malleoli, while the higher quarter cover the malleoli. Now the lower quarter are satisfactory for most clinical purposes as they can be easily done, while in the cases of the higher quarter, these are the following indications, that the higher quarter are used in the cases of rigid pes equinus, and they are also used when there is absence of the AFO, so that they can provide the foot stability. But these are more difficult to don and they are more expensive. And in the cases where the patient is wearing the orthosis that is molded about the ankle, which means that if there is any adjustments or the modifications made to the orthosis at the area of the ankle, then in that case we don't use the high quarter. Now that's all about today's lecture. If you have any query, you can comment down below, and if you enjoyed my video, hit the like button, subscribe to my channel, and also share my video with your friends. And thanks for watching.